This is Coronavirus Brief Update number 5 for Granville County EMS, dated April 24th, 2020. And if you missed any of the previous updates, I have again included the links for those in the notes below. Now, with these updates, we usually talk about what's going on in North Carolina in terms of numbers, give any clinical updates that you need to know for providing high quality care. We talk about policy and procedural changes moving forward, and then we usually close by predicting what's likely coming over the next couple weeks. In this update, specifically, I don't really have clinical updates. I will, however, strongly encourage you to watch Coronavirus Brief Update number 4 because we did talk about some very important clinical information. Specifically, information about how the pulse ox readings in coronavirus patients are different and can be misleading, and how maybe we should change our decision making in terms of whether we intubate or, more specifically, try to avoid intubation. We also talked about patient positioning. So, if you haven't had a chance to see that video, I would strongly encourage you to watch it. In this video, I want to focus a lot on the numbers because we really are at a very important point in the evolution of coronavirus in North Carolina. So if you just look at this week's numbers, you see about 7,200 confirmed cases, 242 deaths, and those have both increased over last week as expected. Interestingly, though, the hospitalized patients, 434, is actually slightly less than last week. And what everyone is wondering, the million-dollar question is, have we peaked in North Carolina? You'll remember we said that there were two models, two predictions as to when we would peak. There's the standard epidemiological model that's used by the Department of Public Health, that's used by the CDC, that predicted we would not peak in North Carolina until mid-May. The University of Washington model, which so far has been more accurate and has accurately predicted New York, for example, actually suggested a much earlier peak, that we would peak around April 15th or 16th and have a slightly lower peak. So the question is, did we peak? The problem with figuring that out is you really need a couple weeks of data after the peak so that you can convincingly say that the numbers are at least stable or going back down. So the truth is we don't quite know yet for certain, but there is reason to be cautiously optimistic. If you look at total COVID cases in North Carolina based on the date that specimen was collected, and you look at this, you can maybe convince yourself in this chart that it looks like things might be flattening out. Now, we don't know for certain because there are still specimens that haven't been reported that were collected over the last couple of days but haven't finished processing, and so the shape of this curve, particularly in the gray box area, could change. It could steepen when we have the final data, but tentatively, this and some other data implies that we may have in fact peaked sometime in the last 7 days. And whether we peaked in the last 7 days or we're approaching the peak, we really have to start asking ourselves, well, what's next? What can we expect after the peak? And particularly as EMS providers, what are things going to look like moving forward into the summer? So I can tell you what we're not going to see. We're not going to see a graph like this where we peak quickly and go back down quickly. In China, they were able to do this. They were able to get their community transmission rate to drop quickly, almost to zero. South Korea, they were able to create a graph like this. But quite frankly, in the United States, this is not going to happen. And, I try not to be political in these talks, but there is obviously a political backdrop to all this. And the U.S. federal government's response has been probably one of the worst responses of any developed country. And that is why we have so many more coronavirus cases than most other developed countries. And because of the very poor response of the government, the lack of testing, the lack of federal support, and in some states, state support for widespread testing, as well as contact tracing, we don't have the ability, the infrastructure to make the cases go down quickly. And quite frankly, Americans in terms of culture probably aren't willing to do the types of isolation that would be required to accomplish this. So what we're going to see in the United States is much more like one of these two graphs, either the blue graph where we peak and then have a much slower decline, a much longer tail, or the red graph, which is almost more like a plateau where we stay high for most of the summer. The other problem is we could also have this pink graph where, we think we've plateaued, we let up on some of our restrictive measures, and then all of a sudden we see an explosion in cases. And so these are all possible, and a lot of it depends on how we approach reopening. So you may have seen this graphic. It's been circulating in the news a lot. Basically, this takes the predictions from the University of Washington model and says, when would it be safe to start easing social measures? So interestingly, North Carolina is one of the states that could do this the earliest. And that's because we did such a great job of canceling schools and social distancing. And we did that very early on when we had very low community transmission. Some other states like Seattle, New York, California are also doing a great job with these measures, but they had a lot more community spread before they put these measures in place. And so it's going to take them longer to get their curves to flatten out and start to go down, which means the recommended opening dates for some of those states are later. But what you see when you look at the dark orange and brown states, these are the states that really have done very little in terms of coronavirus. These are a lot of these states, they decided that, either they didn't think coronavirus was going to affect them or they didn't take the science seriously. And as a result, they've done very little in terms of proactive measures. And so a lot of these states shouldn't be opening or shouldn't be relaxing their measures until as late as June. The problem is these same states that did not really pay attention to the science in the first place are also the same states that are arguing that they should open sooner. And again, it's hard not to be political about this, but there's a political backdrop. There are certain state governors who simply don't believe the coronavirus is a significant threat. And so today, actually, Georgia, South Carolina, and I believe it's either Oklahoma or Ohio have announced that they are significantly easing social distancing. For example, in Georgia, they're reopening movie theaters and restaurants. And what you can see on this graph is that those same states, South Carolina, Georgia, states in the Midwest, in the middle of the country, they're absolutely the last states that should be relaxing social measures. So these are where there's probably going to be significant spikes. And so what a lot of these states are probably going to experience is a graph much more like this, where we're going to start seeing an acceleration of outbreaks, particularly in the middle of the country. People have said the first wave of coronavirus was really on the coasts, New York, California, Pacific Northwest. The next outbreak is really going to be in the middle of the country. But at least for us in North Carolina, because of the measures we've taken and strong state leadership, we should be able to keep our curves either to the blue curve or the red curve. So what does this mean for us moving forward? Well, remember when you peak, maybe a week or two we were here on the curve. Now we're here on the curve. So we're still at the peak, right? So cases are going to remain high for a while. We're going to continue to see respiratory cases throughout the summer. We're probably going to continue to see higher acuity than we're used to when it comes to respiratory illness. The emergency department volumes are likely going to remain depressed, probably 25% below average for this coming summer. And EMS volumes are probably going to stay pretty stable. So the point I'm trying to make is what we're seeing now is what we can likely to see throughout probably at least June and July, May, June, July. So it's a good time to take stock and ask, well, how do we do? In terms of navigating this peak, how well did our system hold up? So I would say at Granville EMS, we did pretty well. Our PPE supplies remain tight, but available. We did not run out of PPE. We anticipate that we'll have enough PPE to meet the summer demand that's going to continue. The real challenge in Granville County is the lack of PPE in first responders. And this is not a Granville problem, but this is a county problem that we are continuing to work on. We have stopped having first responders respond to most of our calls to try to eliminate patient contact. However, they're still being dispatched on critical calls. And of course, those are the calls where COVID is probably more likely. And so the issue of first responders having adequate PPE is a big one that we're working on. In terms of personnel, in terms of our staffing, we maintained staffing pretty well. There were some places in the country where they had 20% of their workforce out due to COVID. At Granville, we've had a very low number of people go out, either because of illness that they had or having to go out for family FMLA reasons that were COVID related. So we managed to keep our staffing levels pretty stable. And in terms of call volume, our call volume in EMS matches what we would predict as our normal amount of growth. So, we did have more calls this month, March, April, than we did a year ago, March, April, but we expect more calls because there's just natural growth that occurs in the county. But we didn't have a sudden surge in calls. So that's the summer. What are we talking about after that point? Well, most of us believe that COVID is going to resurge in late fall. And that's because environmental factors, drop in temperature, lower humidity, all of those things favor the spread of respiratory illness. That's why we see flu and cold season in late fall going into winter. Also, a large percentage of the U.S. population probably won't have antibodies by the fall. So there's some really interesting studies coming out of New York right now saying that in New York City, where there's just incredibly high rates of COVID and exposure, probably about 20% of people in New York City developed antibodies. Similar studies looking at other parts of the country that weren't as hard hit are showing much lower numbers, like 1 to 4% of various populations having antibodies. So the point is that only a minority of people in the country on average have antibodies, and by the time winter rolls around, that number will probably still be in the minority. So you're going to have a large percentage of the population susceptible. So the combination of that and the increased environmental spread, we're likely going to see a significant surge. On top of that surge, we're going to also have our normal flu season, right? The flu is going to come this year just like it has every other year. And one thing to keep in mind is our healthcare system, the American healthcare system, is designed basically to barely be able to handle the flu season. The flu season is the biggest challenge to the healthcare system that occurs on an annual basis. And every year when we're at the peak of our flu season, our healthcare system is really at the peak of its abilities. So we're going to have the flu season maxing out our healthcare abilities as it does every year, plus the combination of a second very aggressively spreading respiratory illness. And you combine those and you're going to get this huge up spike. And so, this is a lot of the reason why people say that, this is not even the beginning of the pandemic. The pandemic is likely going to come next fall. So what that means is we really have 6 months to prepare. And that's a long time that can be used well. We can use that to increase our supply chains, get more PPE, come up with policies, procedures that will allow us to handle that surge. Of course, we have to make good use of that time, and the federal government and some of the state governments have, at least thus far, not really made good use of the lead time. For example, in January, February, when it was very clear we had a global pandemic, there was a lot of inaction. So a lot of how we handle next year will really depend on what we do in the next 6 months. And so obviously we're thinking about that at Granville. But for now, as we come into the summer, as I said, EMS volumes likely will be stable. The thing that is really going to be unique this summer is we're going to see a lot of respiratory illness continuing through the summer. Normally, we just don't see that. Normally, cold flu season dies off about this time of year. By May, we start seeing very few cases. But COVID is probably going to remain fairly present during the summer. We're going to still have interfacility transports for respiratory illness probably throughout the summer, even though the ED remains slow. And so, the key is going to be continuing our PPE use. We're going to be using the SC2 protocol, I would imagine, for at least the next 1 to 2 years, and using, aggressively using PPE for that time period. Hand washing obviously remains key. For now, if you have an illness, we're going to continue to follow the CDC's guidelines of a mandatory 7 days off, even if you feel much better after a day or two. And as I said before, we're going to continue to look for options for antibody testing for our providers. As I said, at this point, the antibody tests are hard to interpret. A lot of them aren't FDA approved, but if there seems to be a test out there that's useful that could allow us to change what we do, certainly I will let you know. And one thing I want to just close with is we do appear to be using PPE well at least in terms of masks. When we review our supply levels, we see we're going through a lot of masks, but we're going through a lot of masks, but not so many gowns, and not so much eye protection. And so I just want to make sure that you are using the full PPE with these patients, because we probably should be going through more eye protection than we're going through. And PPE, I know we've hammered the mask. Put a mask on yourself, put a mask on the patients, but also don't forget eye protection. Your eyes are a mucous membrane too, and droplets in your eyes can cause transmission. Getting droplets on your gloves and then rubbing the side of your face where your eye is, the part that's not protected by the mask, can cause transmission. And so I just want to make sure that everyone is also using eye protection. If you're a contact lens wearer, but you have glasses, this might be the time to wear glasses at work, because that adds just an extra level of protection. But please make sure all of your mucous membranes, not just your mouth and your nose, but also your eyes, are covered at all times. And with that, I just also want to say, thank you for everything you guys have been doing. We have navigated this crisis and what we think is likely the peak at this point in time reasonably well. And a lot of that comes down to, all of you taking, what we've been talking about seriously, taking PPE seriously. I think that's a big reason why we've managed to maintain staffing levels at good levels. It's the best thing we can be doing for our patients. And, I know this is incredibly just scary and odd time, but we will get through this, and we will do our best to support you all through this. As always, if you have any questions about anything I've said, feel free to reach out to Jonathan, Alan, myself. If you are ill and you need to make the decision of staying home or need to know when you can come back to work, also reach out, to, again, myself, Alan, Jonathan, and we'll involve Paula, and we will make that decision together. But the important thing is to keep the lines of communication open. So with that, I will say be safe, and I look forward to our next update.